We are back and we're moving into our first conversation for this morning. This is our COVID-19 update for today, brought to you by Full Tech Systems. We are joined via Skype by Dr. Jorge Hidalgo, who is a critical care specialist, works in both the private and public sector. Good morning, Dr. Hidalgo.
Good morning, and thanks for having me.
Good morning.
Yes, and practicing good social distance, you are safe in your home or office.
That is important.
Okay. So, Dr. Hidalgo, there's a whole lot to talk about in having our viewers and helping us understand COVID-19 and the developments that we've seen over the past few weeks. One of the issues I wanted to talk about was the community spread and what that may mean. Can we start there?
Yes, well, there are too many new developments, and as you know, we are bombarded with information every day. Yeah. And new developments. We need to. We are still learning a lot from the virus, as much as we already know. There's still a lot to know. But the fact that the community spreading is critical, in the sense that essentially all of us, we need to adhere right now to social distancing. And one of the probably most important aspects, as you know, and the most recent information that we have, is that now the transmission of the virus, it could be just as simple as we are speaking with each other. And that is one of the reasons why we need to try to keep the 6 feet rule. However, in many instances, it's very difficult to adhere to that, because people need to go to a grocery store, you need to go to pharmacy, or you need to do other things that are asked you to do because of work. And then that's the reason why now we are recommended that everybody that's go outside, they need to wear a mask.
Yes. Yeah. So the developments we have to keep in mind that it's only been 3 months since we've been learning more about the virus, and the information seems to be changing or becoming better defined. Tell us some of the new information that's been revealed so far.
Well, in terms of the understanding of the virus, we know that it's a very high transmission type of virus. Mm-hmm. A virus that have a capacity to adapt. As you can see, one of the main characteristics of coronavirus genetic information is that they are capable to escape species. As you can see, the initial from a bat, then to a reservoir, and then jump into a human. And that ability of genetic information is really important for us to understand. That is a virus that is very aggressive. And of course, when I will basically probably repeat some of the things that I already mentioned, but once the virus entry to your body, then especially go to the respiratory system. And when it's in the respiratory system, then we can see a start of a cascade of events. That it will vary. There are some people, as you can see, that they probably will have in contact with the virus, and they are going to be completely asymptomatic. And then you will see somebody else, probably the same age, and they ended with a very aggressive form of the condition. Probably that I will depend on that, because at the beginning we was thinking that probably those people that are with a medical background, they are and still more vulnerable, but now we are seeing a pattern that the condition can affect even a younger population. And that's probably an important factor, is the genetic response, how your body and your immune system responds to an infection. Normally, your immune system has the ability to basically release an immune information to attack and essentially battle the virus. But in some circumstances, this response and this mechanism is not active, and then we end to have a really bad condition, bad form of condition. I mean, that's why now the recommendation, now we've seen that the condition can affect anybody at any age, and all of us need to be and take over precaution, because at this stage, nobody is essentially immune to that.
Now, Dr. Hidalgo, talk to us a bit about the use of face masks. That is still very much up in the air when you talk to persons who would argue that you should and others who would argue that you should not. From your medical perspective, what is the proper thing to do here?
At this stage, based on the information we are getting, of course, as we mentioned at the beginning, we are receiving information every day. The recommendation now is that everybody that essentially is going out your house for any reason, they must wear a mask. It could be, and as you can see, it could be just a mask that you can use at home. You can make at home, because it's important, that piece of information, because if it's not necessarily a surgical mask, because if I say surgical mask, or we say surgical mask, then you know, everybody probably are going to the pharmacy and trying to finish the stock that the medical personnel that are in the field, they will need those type of masks. But we see that just to cover your face with a piece of cloth that is of course properly done at home, is going to be enough just for the protection to somebody else, and also to protect ourselves. It's essentially a social responsibility and a better weapon that we have right now to protect each other.
And this advice you clearly said is not necessarily a surgical mask. Use a cloth mask, and only if you have to step outside, if you're going to leave your home and interact with other people.
That is correct.
Okay. Because I know that the WHO does share that same concern that you said, that if people rush surgical masks, then you may actually leave your medical staff in a situation where they can't get access to it.
Mm-hmm.
Exactly, and then that's we need to be essentially cautious, because our medical personnel that are in the front line, they will need those type of equipment. Yeah. And it's been essentially said that for this type of protection, a cloth mask should be enough for this type of interaction, of course.
Now, when you mentioned earlier that we need to function in a different manner when it comes to who we think is going to get severe or critical forms of COVID-19, from what we're seeing globally, I mean, the very early information out of China was primarily older people, people with previous medical conditions. But slowly, over the past few weeks, we've been hearing these stories of young people, healthy people, children being affected with severe COVID-19 and needing to be hospitalized. What does that mean for us here in Belize, and what type of precaution? Because maybe we've only been protecting our elderly and not realizing that the younger population is still very much at risk.
And that is important, no? Because as you know, we as a younger people sometimes take things for granted. No? We believe that we are strong enough to fight whatever it is, and unfortunately that is not the case. And then we decided to go out without precautions, believing that we are essentially, our body can get all these type of infections. But unfortunately, this is in the case of COVID-19, every day we have new information, and we know that it can affect people at every age. And just an example, in New York, essentially a husband and a wife, both of them contracted the virus. The husband ended extremely ill and died at the hospital, and the wife had the virus, and not really bad. No, she survived with minor symptoms. And that is something that that everybody is trying to understand, why to be aggressive in someone and not as an aggressive to other ones. And one of the things, it has to be with your immune system, and also with your genetics, your genes, the way how the body is going to respond to that.
Mm-hmm.
That is interesting because I was thinking the same thing. Now, I'm fully aware that it's only one strain in a manner of speaking, but how your body reacts to it makes it seem as if though perhaps one person can withstand and have mild symptoms and gets through it within a few days, whereas another person ends up in the intensive care unit and has to be placed on a ventilator. Let's go back a bit about building the immune system, perhaps with your diet, perhaps with your lifestyle choices and that sort of stuff.
Well, as I mentioned, in a normal circumstances, if you are exposed to any type of virus, the body have a substance that is called the interferon. The interferon is a special substance in the immune system that will recognize immediately and it will activate immediately an immune system response. And then if these substances essentially act promptly and it's working, then we will have the condition under control, and probably we will develop certain level of inflammation, but it's not going to be that bad. However, in other people, these substances probably is not going to activate, and then you will end it with this kind of condition, and your body is going to create, and we are seeing with COVID-19 that the body is creating an overreacting inflammation response, and sometimes it's too much that the body can't contain. And we need to. There are many now medication that we are trying to use to contain this over inflammatory response that the body is creating in response to the virus.
Now we've seen where, and there have been universities and scientists trying to study and understand more about this new coronavirus. And one of the things that was revealed last week was the extent of damage it can cause on the lungs and how quickly. I'm sure you've seen it. There's a 3D model out that many people are using. What does that say, and how different is this from the pneumonia that people maybe have experienced before in the past?
Well, the situation is the next. As I mentioned, and I will repeat, the virus, essentially, one of the receptors of the virus needs to enter to our body. Mm-hmm. And the first thing the virus does is the famous spike that we talk about, mm-hmm. and that essentially have the virus name, the coronavirus. This spike goes and attach to a special cell in the lungs, mm-hmm. that we call it pneumocyte. Mm-hmm. This is, and when this attach, this is not the only mechanism, but when the virus goes to the lungs and mm-hmm. with this particular cell, is another two type of enzymes that are critical for the process to adherence and also to entry the lungs is important. And when the virus entry that and entry to the lung, then start to multiply, have many copies of the virus, and start an important inflammatory response in the lungs. Mm-hmm. And that is the beginning. Initially, what we can see is, we call it a leakage of fluid into the respiratory system. Mm-hmm. And that essentially, slowly, if we are not able to control this inflammatory response into the lung, it will lead to something that we call it slowly to multi-organ failure. I mean that the patient initially will start to essentially gasping for air, then we need to supply oxygen. Slowly, the body is going to become dehydrated, and we need to give fluids, because then one of the most sensitive organs to the dehydration is going to be the kidneys. The patient is going to enter in a kidney failure, and it's a cascade of events that ended in a multi-organ failure. One of the other things that it plays an important role is a very disorganized and a huge amount of inflammation that the body is unable to contain, and that's one of the reasons why the patients end in multi-organ failure. One of the reasons, and the main reasons for a patient to die from these conditions. One is cardiac problems, because the same virus, it will lead to something that we call it myocarditis, which is an inflammation to the virus to the heart. And also the second reason why we see in those patients die is due to sepsis that essentially progress to multi-organ failure.
Wow. That was a very detailed description that really shows the level of damage that this virus can cause to the body. And you've clearly said multiple times that we have to stop thinking of just specific groups being vulnerable and consider that we all may be vulnerable. But let's talk about the time frame and how do you know when you should contact the Ministry of Health to be tested? So you could have symptoms and be at home and feel fine. But what's the time frame and what kind of symptoms should we be looking for?
Well, that is an important question, because for us as a medical practitioner to be able to help a patient, the time is important. I mean that in those cases, if you probably are positive but asymptomatic, if you start to develop symptoms, if you have sore throat, you have fever, but if you start with respiratory symptoms, you need to contact immediately the hotline. Before you go to the hospital, you need to contact the hotlines, the Ministry of Health or your medical family doctor if you feel confident, but don't go to the hospital. Contact them first, and because then they will give you an instructions as how to address that, and also to send people for you to be tested and give you recommendation as how to go to the hospital. That's the most important thing. In terms of phases, the first phase probably is going to be a febrile phase with probably a very general symptoms. And it can last between 1 to 7 days based on the information we have. Of course, please take in consideration that this information, it changes every day. The second phase is something that we call it a respiratory phase, that it can probably last as well as between 1 to 7 days. And then is when the oxygen and the respiratory symptoms are going to appear more. The patients are going to start with respiratory symptoms. And then, of course, this phase, you must be at the hospital. You can't wait, because it could be very detrimental, and if you don't attend on time, it could be fatal.
Wow.
The third phase is probably one of the most important, and in the case, very in terms of your body response, is the over-inflammatory response that is going to happen in the body. And this phase is extremely critical. More likely, this type of patient in the third phase are already in an intensive care unit attached to a mechanical ventilation with all the necessary support to control this disorganized and exuberant inflammatory response that the body is creating.
So, from what you've explained, if we have certain symptoms, so if we have the fever and we have the sore throat, we should contact the hotline to get direction as to whether or not we should get tested, and they will guide us through that. But what you said very clearly about that second phase, is that where you would kind of have the breathing problems, like I can't catch my breath type of symptoms?
Yes, the most important thing in this is that people need to recognize the symptoms, the initial symptoms: fever, sore throat, probably muscle ache. In some cases, you can have diarrhea. Then you need to get in touch immediately to the hotline and trying to get the proper direction as how to get medical attention, but most importantly, to be tested.
All right. Any final advice to the Belizean public, Dr. Hidalgo? You've really shared a lot with us so far.
Well, I think so. The most important advice I want to tell you is that our best weapon is prevention, precaution. No matter if we have 100 ventilators in the country, we don't want to use it. The most important thing is that we need to have a social responsibility to each other and assume, and it's difficult, say, we need to assume at this stage that we can have the virus and everybody is positive and over precautions. Wear your mask, use water and soap. If you don't have a water and soap, use your alcohol, different other options that you can have to clean your hands. One of the most important things is the knob doors, no? Because we touch it all the time. Meaning if you need to wash your hands 50 times, let's do it. But our best weapon is precaution and adhere to the social distance. Don't take it for granted. This thing is serious, and we need to have this coronavirus 19 as very serious and lethal virus, and we need to have all our precautions.
Thank you so much for joining us this morning, Dr. Hidalgo. We appreciate it.
Thank you.
Thank you.
Have a nice day.
All right, and we're going to go ahead and take a break. That was our COVID-19 update brought to you by Full Tech Systems Limited. We'll take a break and we'll be back in a few.